Hello, everybody. Welcome to our presentation. Today, Emily and I will be talking about how to support children who have a voice disorder. This is a presentation from the University of Sydney. We would like to start with an acknowledgement of country. We acknowledge and respect the traditional lands of all Aboriginal people. We respect all elders, past, present, and future. We ask all people that walk, work, and live on traditional Aboriginal lands to be respectful of culture and traditions and work together as one to better Aboriginal health. This presentation will cover what a voice disorder is, what the impacts of a voice disorder are in children, causes and characteristics of a voice disorder, and lastly, how to support children with a voice disorder in the classroom. Voice is the sound produced by the vibration of the vocal folds. The voice of someone with a voice disorder may sound hoarse, husky, strained, or strangled. The voice's pitch could also be too high, too low, or the voice could sound too loud, too quiet, or too weak. There are also disorders of resonance. These characteristics occur because the vibration of the vocal folds is ineffective. I will speak further about the causes and characteristics of voice disorders later in this presentation. Voice disorders affect more than 5 million school-aged children annually in the US alone. The prevalence of voice disorders in children has been estimated at between 6% and as high as 36%. This is therefore a disorder that impacts a significant number of school-aged children. Hence, it is important that teachers understand what a voice disorder is and how to support children who have a voice disorder. A peer review study was conducted in 2008 to examine the attitudes of children with voice disorders. The study found that there were a host of negative social and functional impacts for children with voice disorders. Children reported fears of being teased and laughed at and imitated by others. They feared always being asked to speak up and not being understood, as well as having to talk on the phone. They feared sounding dumb, sounding like a smoker, and missing out on things due to their voice, as well as social exclusion. They also reported emotional impacts, including feelings of anger, sadness, depression, irritation, and nervousness when they can't participate in activities because of their voice disorders. Feelings of embarrassment, reductions in self-esteem, and not liking the sound of their own voice. Types of voice disorders include resonance, pitch, volume, weakness, and hoarseness. I will now begin with hoarseness. Firstly, it is very important to know what vocal characteristics to look out for in your students when identifying a voice disorder. A hoarse voice is when someone sounds rough, raspy, or breathy when speaking. Hoarseness happens because the vocal cords are strained. In children, this can happen from everyday things, like cheering loudly at a ball game, belting out a favorite song in the shower, or calling out to friends on the playground. Sounding hoarse for a few hours in the day or after a big game is nothing to worry about. Usually the voice returns to normal on its own. But chronic hoarseness can last for days, weeks, or even months. If this happens, a child needs to be checked out by a doctor. Speech therapy may be needed to get the vocal cords back to normal. Here is a clip of a hoarse voice. A hoarse voice can also be caused by vocal nodules, cysts, or polyps. Alternatively, it can be caused by viral infection such as a cold or laryngitis. If the child's hoarse or husky voice is a result of inflammation in the voice box following infection, hoarseness will be temporary and usually disappears when the infection clears. To speed up the healing process and help the child's voice return to normal following such infection, encourage them to frequently sip fluids and rest their voice until they get better. Another common cause of a hoarse voice in children are vocal cord nodules. Vocal cord nodules are the top cause of chronic hoarseness in children. Chronic or long-lasting or ongoing misuse of the vocal cords from things like lots of yelling or using voice in an unnatural way consistently puts excess wear and tear on the vocal cords. They may stretch too far or rub together, causing small irritations. If these aren't allowed to heal, they turn into small calluses or vocal cord nodules. There are also disorders of resonance. Resonance is the quality of the voice that results from sound vibrations in the throat, mouth, and nose. Hypernasality is a type of resonance disorder where too much air comes from the nose while talking. I will now play a clip of what hypernasality sounds like.
Okay, Sarah, say, put the baby in the buggy.
Put the baby in the buggy.
Take Teddy to town.
Take Daddy to town.
Do it for Daddy.
Do it for Daddy.
I eat cake and ice cream.
I think an ice cream.
Go get the wagon.
Go get the wagon.
Say, I see the sun in the sky.
I see the sun in the sky.
She went shopping.
She went shopping.
I ride a choo-choo train.
I ride a choo-choo train.
Individuals with cleft palate experience hypernasality. Cleft palate is the splitting of the roof of the mouth. Hypernasality can be a result of the palate that is too short or the inability to move the muscles correctly. This can be seen in cerebral palsy. Less commonly, hypernasal speech can occur in someone with an undiagnosed problem of the palate muscles. Hypernasality occurs from the soft palate being down too much during production of nasal sounds, including the sound M, when it should be up. This is observable when there is a mirror placed in front of the child's face when speaking. The mirror would become foggy as there is too much air being emitted from the nose. Another resonance disorder is hyponasality. Hyponasal speech is the sound of speech that results from too little air escaping through the nose. So this sounds like someone talking with a stuffy nose or a blocked nose. The most common reason for this type of speech is enlarged adenoids or tonsils that block the air passage to the nose, causing the voice to be less resonant. Adenoids can become enlarged for many different reasons, including exposure to viruses, bacteria, fungal and parasitic infections. This happens because the soft palate stays up the whole time while you're talking, when it should come down. Another type of voice disorder are pitch disorders. A pitch disorder occurs when there is a change to a child's typical pitch, making them sound either higher, lower, or more monotone than usual. Pitch disorders are usually due to a change in the function of our vocal folds. A child may also have a voice that is too weak or quiet. A weak voice is often the result of poor vocal fold movement or incomplete closure of the vocal folds during speech. Causes may include vocal fold paralysis or narrowing of the larynx. Children who have had a breathing tube during a period of illness or due to prematurity are at a higher risk of weak voice and may experience long-term voice problems. Hearing loss can also impair voice production, causing social, educational, and speech limitations with specific deviation of the communication related to speech and voice. In Australia, 1 out of every 1,000 children is diagnosed at birth with hearing loss. By the time they reach school age, 2 in every 1,000 children are diagnosed as having hearing loss. Usually the voice is not the main focus of speech therapy for individuals with hearing loss, but its deviations can represent such a negative impact on this population that it can interfere on speech intelligibility and crucially comprise the social integration of the individual. Hearing loss impacts many aspects of a child's voice. These vocal deviations include strain, breathiness, roughness, monotone, absence of rhythm, hoarseness, vocal fatigue, high pitch, reduced volume, loudness with excessive variation, unbalanced resonance, and altered breathing patterns. These characteristics are caused by the incapability of the person with hearing loss to control their vocal performance due to the lack of auditory monitoring of their own voice. Hence, improving the voice of a child with hearing is a challenge despite devices such as hearing aids, cochlear implants, and other implantable devices.
There are many ways to support children who have a voice disorder in the classroom. Support for these children involves early identification, classroom adjustments, communicating with parents, and referring them for voice therapy. Georgia has spoken about how to identify children who have a voice disorder in the classroom. I will now discuss some reasons why it is important that a child who has a voice disorder is identified early. Firstly, as mentioned previously, a voice disorder can impact a child's willingness to participate in the classroom. This could make the child fall behind in their learning. By identifying the child who has a voice disorder early, their participation and learning in the classroom will be improved quickly as they will receive the support they need. Secondly, as mentioned previously, children who have a voice disorder may cause the child to feel embarrassed or lower their self-esteem. These feelings would be addressed and lowered if they are identified and receive support early. Lastly, if left unidentified and untreated, a child's voice disorder could worsen, causing further issues and potentially permanent damage on the vocal folds. This is the third and final reason why it is important to identify these children early. These reasons additionally demonstrate the importance of teachers notifying the child's parents or referring the child to a speech pathologist as early as possible. Following early identification, the teacher can provide support and make some classroom adjustments for children who have a voice disorder. As a teacher, you may notice that your voice gets tired from recess or lunch duty, where you have to raise your voice often to manage the students. You may find this in the classroom also. When this happens, you may have a rest or have a cup of tea and have a break doing some administration as you are mindful of this. However, most children do not have these self-monitoring tendencies. Therefore, if a teacher notices children being really loud in the playground, they can encourage them to keep the noise down and rest their voice after recess or lunch. Similarly, if a teacher notices children making excessive car, train, or dinosaur noises in the playground or in the classroom, they can tell the children to stop. Excessive noises such as these that children make sometimes while they are playing can cause further harm to their vocal folds. These are important supports to implement, as prevention is the best cure. Additionally, since teachers exert themselves to keep students' noise down, vocal care and resting the voice is important for teachers too. Different aspects of vocal care will be detailed in my next point. Vocal care is a key element to supporting children with a voice disorder. Vocal care is a regimen of good habits that are implemented to maintain healthy vocal folds. As mentioned previously, these vocal care practices can be applied to teachers also. These good habits that can be applied to maintain healthy vocal folds are as follows. Firstly, teachers should refrain from shouting over noise to speak to a child with a voice disorder. It is important that teachers go up to the child and speak to them directly to prevent the child from having to raise their voice over the noise in the classroom to reply. Similarly, teachers can make sure that whenever the child with the voice disorder wants to talk to another child in the classroom, that they move to get closer to that child so they do not raise their voice. Secondly, in the classroom generally, teachers should make sure that the child with a voice disorder is not frequently raising their voice when talking to others. Teachers should encourage an inside voice so the child is not causing further harm to their vocal folds. Teachers should also make sure that the child is not yelling or screaming in the classroom. Similarly, they can ensure that the child is not screaming or shouting frequently in the playground. Thirdly, teachers should make sure that the child is staying hydrated by drinking lots of water throughout the day. This is important as water helps the vocal folds to vibrate fully. When the vocal folds vibrate fully, a better voice is produced. Teachers should ensure that the child is drinking water throughout the day, both within the classroom and during recess and lunch if possible. To make sure that the child does not feel singled out from the class, teachers could encourage frequent water breaks throughout the day for all students in their classroom. Teachers can also make sure that they themselves are staying hydrated throughout the day to prevent harm on their own vocal folds. Lastly, as mentioned previously, teachers should make sure that the child is spending some time resting their voice during class. They should encourage the child to have some quiet time throughout the day so their vocal folds are spending some time resting. Teachers themselves should also take some time to rest their voices where possible throughout the day. By implementing these 4 habits for a child with a voice disorder in the classroom, teachers will be helping them to maintain healthy vocal folds. This is very important to ensure that a voice disorder is prevented or that a child's voice disorder does not become worse. Teachers can also implement some of these habits to protect their own vocal folds too. Next, teachers can adjust the seating in the classroom so that the child with a voice disorder is seated towards the front of the class. This will ensure that the child does not have to raise their voice when speaking to the teacher or answering questions. If the child is participating in classroom discussion, the teacher will be able to hear them at the front of the classroom without the child having to raise their voice. The teacher can then repeat what the child has said for the class if necessary. If the child must present an oral task, for example, a speech, the child can stand at the front of the class and the teacher can have the other children seated as close to the child as possible while they are presenting. For example, instead of having the rest of the class seated in the seats around the room, the teacher could have them sitting on the floor directly in front of the child presenting. This will mean that the child does not have to project their voice so their peers sitting at the back of the classroom can hear. Another way to support a child with a voice disorder who has to present an oral task is to allow them to pre-record their presentation at home and submit it to the teacher. This way, the child will similarly not have to project their voice in the classroom setting. This would also benefit the child if they feel embarrassed or have low self-esteem due to having a voice disorder. Additionally, communicating with parents is an important aspect of providing support to a child with a voice disorder. As mentioned previously, it is important that if teachers notice a child in their classroom with a potential voice disorder, that they let the parents know straight away. By telling the parents as soon as possible, the child can hopefully receive support early. Additionally, if a teacher notices a child with a potential voice disorder, recommending the parents to refer the child to a speech pathologist for voice therapy will further support the child. When referred for voice therapy, the speech pathologist will be able to assess the child's voice and determine appropriate goals for therapy. If the teacher or parent feels that something more medical and significant is present, a speech pathologist may recommend the parent to take their child to a pediatrician or general practitioner to obtain an ear, nose, and throat specialist or ENT referral. ENTs work in conjunction with speech pathologists. ENTs are physicians and surgeons and can advise about something physiological and operate where necessary. For children who teachers know already have a voice disorder, they can encourage and provide some education to parents regarding vocal care to make sure that vocal care is being maintained at home. This can be done by explaining to parents that vocal care helps to maintain healthy vocal folds. Teachers can also explain and provide examples of the different habits that vocal care entails, for example, hydration and vocal rest. This will help to keep the child's vocal folds healthy in all situations within their life. You might be wondering what voice therapy is and what it entails. Voice therapy is provided by speech pathologists, and it involves direct therapy to address what has caused the voice disorder and indirect therapy to address habits that can be easily changed and addressed. Direct therapy can help to encourage and teach the use of better voicing that is sustained across all settings and situations. It will support generalization of the child's voice skills to situations within their everyday lives, including in the classroom. This will improve their ability to participate fully within their daily lives. Improving voicing in a child with a voice disorder will help to increase their participation and learning in the classroom, increase their self-confidence, and stop the voice disorder from worsening. Indirect therapy will teach the vocal care habits as mentioned previously in this presentation and ensure that these good habits are maintained. This will further ensure that the voice disorder does not worsen. Teachers can refer a child in their classroom to the University of Sydney Speech Clinic for voice therapy. The University of Sydney Speech Clinic typically runs all year for blocks of 6 to 12 weeks involving sessions in person or through telehealth. There are minimal costs associated, and the sessions are run by student speech pathologists like Georgia and I, who are supervised by certified speech pathologists. If you would like to refer a child for voice therapy or to address any other communication difficulties, please get into contact with the speech clinic. Of course, teachers themselves are also welcome at the clinic, as we do see adults as well. The clinic's contact information is on this slide for reference. In conclusion, early identification, classroom adjustments, communicating with parents, and referring children for voice therapy will ensure that children who have a voice disorder are supported optimally. It is important to support these children in this way so that their voice disorder does not worsen and so they are able to participate fully in their everyday lives. Thank you for watching.